everybody. Welcome to Meddkit's Provider Spotlight, where every week we are interviewing the most amazing private practices from all over the United States. Every week we have someone new specialty, and most importantly, a brand new perspective. Every time we come on here, I think everyone has something new to say, something very eye-opening. And so I'm very excited to dive into it today. Want to introduce you to a very special guest, Dr. Shawn Leatherman. He is the owner of Integrity Chiropractic in Mary Esther, Florida. Welcome, Dr. Shawn. Excited to have you.
Great. Excited to be here.
Yeah, I'm excited to kind of dive into things, but something that I like to do a little bit in the beginning, and I think everyone, ultimately wants to know who you are, what got you here. So if you would, tell us your story. What had inspired you to open up your own practice?
That's a long story. I'll try to make it as short as possible. Um, Basically, I was getting ready to go into orthopedic surgery. That's where I thought I was going to go for healthcare. When a friend of mine who was a pharmacist actually talked me into going to chiropractic school with him, and so moved across the country, went through chiropractic school, got out, became an associate for a year. Saw a lot of cases. I became an associate in an office. That was a very big clinic. We were seeing 400 patients a week with multiple doctors, so exposed to a lot.
Yep.
And then Hurricane Ivan came through. I was in Pensacola, very bad for Pensacola, lots of damage. Clinic was shut down, and basically I was let go. So at that point, my wife and I had just moved across the country. We just bought our first house. We'd both just graduated chiropractic school. She was pregnant and we're both unemployed. So it was a very scary time in our lives.
Yeah.
And we just decided we either needed to find another associateship position somewhere along the line where we couldn't control our own destiny, or we would open up our practice at that time.
Yeah.
And had another friend who was a chiropractor, and we all decided we were going to open up a practice together and basically uh, get all of our resources together, split costs. That's what we did.
Yep.
We did that for about 7 years. And then we separated the practice into two different locations. And he went north, my wife and I went south. And then we built those two respective practices up basically to the place we were at with three doctors before. And we've been in practice now for 22 years.
That is awesome. Yeah, it's amazing what you do when you're faced with adversity. It's sink or swim time, and
Yeah.
it's very cool to hear, your story and the challenges and adversity that you face, but also, had some great mentors and some great experience to carry you on through, and here you are today. So I love that. Would love to, dive a little bit more into, your practice specifically. Would love to know, I think when people think about chiropractors, they can assume maybe some things about what you might do, areas that you might treat, but maybe you can talk about some of that, but also maybe some harder cases that you see on a weekly basis.
Sure. I'd love to do that. Our office, I mean, we're traditional chiropractic office. We do the traditional chiropractic things.
Hmm.
However, over the years, we have morphed and we have grown. We have in our office the coursework that we've done. We've specialized in chiropractic biophysics and structural work. We also have specialized in sports injury, and we've also specialized in motor vehicle crashes. So I have additional credentialing through all those organizations and certifications.
Hmm.
My wife is also in the practice, has gone through chiropractic internist diplomate. So we do functional medicine, gut health, weight loss as well. She handles that side of the practice. That's not where my expertise lies. And we've just continued to grow. Over the years, we've done neurodiplomate classes. We've done Motion Palpation Institute. We've done extremity exams. We did sports. We've done brain concussion, auto crash reconstruction,
Wow.
child passenger safety. You name it, we've done a lot of coursework. And so that gives us a lot of breadth. We see quite a few pregnant patients as well. Patients in our office are as young as, a week old up until close to being 100. And so
Wow.
it's pretty diverse. But realistically, chiropractic biophysics, that's the meat and potatoes of what we do. When you see sports injuries, car crash injuries, most of them need structural work. And
Yeah.
so that's kind of the niche that we've fallen into. Um, our clinic does functional rehabilitation and structural rehabilitation together. We
Mhm.
do have decompression in the clinic as well, and we incorporate in rehab exercises for foot, ankle, knee, shoulder, elbow, and spine all together, depending on what the patient needs. So it's quite diverse.
Yeah, I would say so. I mean, it's great that you can, being so diverse, you can really look at the patient holistically and seeing, all the different things that might be going on and, the one thing that triggered it, but then, or sometimes things don't always look the way it seems and it's really stemming from another part of the body. And because you've had that great experience, done all the coursework, you're able to easily identify, some of that. So I think that's wonderful. Would love to know in the office, how your approach, you explained a little bit, obviously, how you're a bit different, but are there other modalities that you're also using in the office that has been really successful in patient care as well?
Sure. I mean, we've got some traditional modalities that we use. Most chiropractors have used electric stim, ice, heat, ultrasound. We have those in the office. We don't utilize them very much.
Hmm.
Um, quite a bit of decompression patients will come in the office. We also have something called a shockwave, which is basically a percussive device that helps to do soft tissue mobilization. They're becoming quite popular nowadays with sports teams, other chiropractors in the office, or other chiropractors in the community, excuse me,
Hmm.
are doing this as well. The things we haven't evolved into, I don't do laser in my office,
Hmm.
not because I don't think it's amazing, but I've got two chiropractors right down the street that have laser. They're awesome doctors. They do a great job. And so there's no reason for me to purchase that type of equipment when I can say, hey, I've got a colleague that's a mile down the road. I'm going to send you down there for laser and have a good working relationship with other professionals. And I think that's one thing that we don't see enough of in chiropractic is people get a patient in the office and they think that they can do everything and they can't, and neither can I. And having resources outside the community is amazing. I had a case last week where the patient came in and I'm going through and doing an evaluation. I'm doing my neurological evaluation on her. She's got a lot of cranial nerve issues. She's got problems with her eyes. And I was like, you need a neurochiropractor. And I've done about 150 hours of advanced neurology coursework. It's
Hmm.
just enough to realize that I really don't know what I'm doing.
Hmm.
And
Hmm.
then I should send them off to somebody who has thousands of hours in this technique. So I told her, I'm like, we'll do the structural work here in the office, but the neuro work, I'm going to send you off to another doctor, have them evaluate you, and have them work with you on that because you need that just as much as you need what we have in the office. And I actually sent them to a doc that's 5 hours away. And I'm
Wow.
like, you can go out there on a weekend trip. They'll meet you on a Friday and a Saturday. Come back and you can do periodic follow ups and they'll do a great job. And she went and did that. She was like, that was amazing. And the interesting thing is, they're very thankful when you do the right thing for them versus trying to keep them in house and trying to do everything here. So, hyperbaric oxygen is a perfect example. We have a
Yeah.
lot of patients that have concussions that when they walk in the door, there's some things I can do in my office to help with concussion. I don't have hyperbaric oxygen. It's an amazing therapy. There's a doctor 2 miles up the road that has that. So, I'm going to refer out to that doctor. Please do an evaluation on this concussion. Make sure you're finding what I'm finding, and let's set them up for some hyperbaric oxygen. And then the patient is going to get the care that they need. So that kind of makes us a little bit different. We do a
Yeah.
lot of things in the office, but there's also many things that we don't do. And I like to stick to where my expertise shines and then farm things out to other people that are great practitioners so that we can get the best result for the patient.
I love that. I think you said it right that you don't see this enough in chiropractic and and I think a lot of specialties too, I think a lot of people want to do their best, truly.
Sure.
But maybe there is an extent where you can't help anymore, and that needs to go to somewhere else, to someone else in your field that either has that technology, and you want to stick to the things that, this is where my niche is. This is what I'm really great at, and I know I can help you with this. And I love that I can also help another community member, someone that is a colleague of mine, and get them a patient and someone that they know that they can really treat. And so I love that you have such great connections with the people that surround you, but also just doing the right thing by the patient. I think not enough people hear that enough.
Yeah. And it could be a little self-serving as well, because it's nice when the patient comes back and is like, thank you very much for getting me where I needed to be. But once you've done that enough in your community, your other colleagues start to open up a little bit more, and they start sending you cases. They're like, listen, I saw this and I know I'm not going to get this patient better, so I'm going to refer him to you for X, Y, and Z, whatever that is.
Hmm.
I'm the only person that does structural rehab in my area. And so now that I've been doing it for a long enough period of time, I've got other practitioners who say, hey, I'm going to send you over here because you need something that we don't do.
Yeah.
And that's great because now we have a great working relationship. I spent the first 6 years of my career not having a decompression machine. The chiropractor down the street had one. So I was like, hey, I got a person that needs decompression. And they're like, great, send them down the road. You do the chiro side, I'll do the decom side. And the patients get better. And 6 years later, when I finally got a decompression machine, he was like, damn, he's like, I'm going to miss those referrals. But we still have a great working relationship 20 years later,
Yeah.
because if you do what's right for the patient, everybody wins.
I love that. Yeah, I think, this is what makes private practice, I feel like, so unique. And the ability to make these really strong relationships, to treat the patients the way you know that they need to be treated, I think is very, very unique to private practice. But I also love how deeply you care about getting patients better. And also by, just doing that, you're helping a whole community of people. So I think that is something that's very unique about you and your practice. Something that I love to talk about on here is, there are a lot of misconceptions in healthcare. I think, especially in chiropractic. I think, especially as, social media has evolved, people are now asking ChatGPT all these questions. And,
Sure.
I'm glad that people are invested in their health. I mean, good for you. You're trying to check things out, but not everything is good and factual. So, what are some of the things that you hear, or people come in and they ask you, say, hey, I read about this or I saw this. Is it true? Or is that what you do? Or I'm nervous. How do you kind of combat, all of these myths that are told about, chiropractic, or just have questions that are just wrong that they've read online?
Well, that's a lot right there. So I'm
Yeah.
just going to start pretty simply. The first thing is I love questions. When a patient comes to my office and they actually ask, good questions, or they talk about their fears, or they say, hey, I heard this, that is an opportunity for you to make a connection with a patient. And I love it when they challenge me, because first of all, number one, it makes me better. Number two, you have a good conversation, and that will usually set them at ease. I'm a big research guy. I have a lot of research papers that I've read. I've been exposed to research from many mentors that I've had. We have probably at least 2,000 research papers that are in the computer database in our office that have been read over times. We've made synopses of these.
Hmm.
I like to talk to a patient about what I know and tell them, hey, this is what I know. This is what the research says. This is my clinical experience. It might be a little bit different what the research says, but this is what I can speak to you on with confidence. And if there's something I can't speak on confidence, then I'll say, you know what, that's a great question. I will find out for you. And then I will actually live up to my word. I'll do some digging. I'll pull up some research. I'll reach out to, and all chiropractors are doing this. Facebook makes it easy. There's groups all over. You reach out, hey, I got a patient with XYZ in condition. I'm not familiar with it. Who's got a research paper? What have you seen clinically? And before you know it, by the next morning, you got 5 research papers that doctors just shared with you. Like, great, and I'm going to read those and I'm going to report back to the patient. And it makes you better in what you do, and what better at your craft, better at patient care. But now you can have a real honest conversation with the patient. I don't need to know everything. The more exposure I have, the better. But that's what reference materials are for. That's what resources are for. So we accumulate references and resources in our practice over time. And I know that I don't have to know anything. I know what I don't know. And
Yeah.
that makes it very powerful. Most doctors out there know what they don't know. The problem is they talk outside of what they don't know instead of saying, hey, that's a great question. I'll find out for you.
Yeah.
The
Okay.
biggest thing that I like to teach patients when they come to my office is first of all, number one, you're required to ask questions in my practice. If you're not asking questions, that means I'm not leading you very well, or I'm not giving you enough information to think about, because I know I'm not that good that everybody doesn't have a question. Nobody is, right? And so they need to be asking questions. Number two, if they go to an outside doctor, and this happens a lot in chiropractic,
Mm-hmm.
I went to my medical doctor. My medical doctor said XYZ, and it's usually something stupid. Chiropractors cause strokes. Oh, really? Yeah, I've seen 15 strokes in just the last month because of chiropractors. First of all, we know that's BS. The literature doesn't support that. And if
Yep.
it and if that was really happening, our malpractice rates would be crazy, and our malpractice rates are the lowest in all of medical. So that's not true. So then you
Yep.
have to combat that. Okay, understood. So your medical doctor said X, Y, and Z. Did you ask him, where did you read that, and may I have a copy?
Ooh, that's a good one.
Right. If a patient comes into me and I say, hey, I believe this, and they
Yeah.
go, okay, great, where did you read that? I'm like, you know what? I did read that in a research paper. We do have a synopsis of it. I did learn it in this class, and it was also in this textbook. What would you like a copy of? I'm more than happy to provide that for you. We'll scan it, we'll email it to you.
Yep.
Well, that breeds confidence in the patient because they know you're not just talking out of the side of your mouth. You actually understand the information. So questions are amazing. I love questions. And if a person is asking you the same question 5 times over 5 visits, two things are happening. Either they don't understand what you're saying, you're not explaining it well, or they can't embody that information. So if they can't embody that information, they're not going to make good changes in their life, and you're not going to get a good outcome.
Mhm.
Again, that should foster good conversation. So that's kind of a big answer for that one small question, but I love those questions. I love those challenges. Addressing them always really boils down to your confidence factor. What do you really know, and what can you explain to the patient? And if you don't know something, don't make it up.
Yeah.
Don't put yourself in a position where you're going to create problems down the road. Just say, I don't know. That's a great question. I haven't researched that. I will put some time in. I'll research. I'll get back to you next week. And then, do the research.
Yep.
Research nowadays takes 10, 15 minutes sometimes, and that's all you need. And you're like, I have 6 great papers. I'm going to
Yep.
read them at night before you go to bed, whatever. Scan them, reach out to a few colleagues. They'll supply stuff to you very quickly. And that's the easy way to handle those objections, those questions, those fears. The biggest fear I get from people is, are you going to break my neck? The popping it scares me, and so you just walk them through. What is the popping? It's just joint escaping the joint, or gas escaping the joint capsule. It's a very simple analysis. I like to use anecdotes from my office about other patients and fears they've had, but then I also like to use corollaries. It's no different than if you pop a champagne bottle, has a big explosion, it's very loud, it's just a gas exchange. If you do it very slowly, you just hear a fizz. So when
Right.
a chiropractor adjusts you with his hands and they do it quickly, it's going to have a loud pop. If they
Right.
do it with a drop table, an instrument, or a very slow technique, you're not going to get those pops. And if you've got patients that are scared of it, alter your technique to meet the patient as long as it's appropriate for them.
Sure.
Explain what you're doing, and eventually you'll build confidence with them, and they're not going to be afraid of it anymore. And that's just kind of the approach we take here.
I love that. It's very important to meet people with where they are, especially when it comes to fear and things that they don't understand. I mean, we didn't go to medical school. There's things
Sure.
that, we we can conceptualize, but there's things we don't understand. So I love that you use different analogies or patient experiences to help describe, what that person will be going through because no one likes to do anything that they're confused about. And so
Right.
I love that you're so perceptive to, if they're asking a bunch of questions or the same questions, hey, is there something that I can do better to make this to help this person understand what we're about to do, or how to, have them live healthier going forward, take my recommendations, so on and so forth. So I love that you are so perceptive in all of this, but also eager to learn the information that you don't know. I think that is a very humble way to look at it. And, there is a limit to what, we all know, and what we're all good at. And so I think if there's something that we don't know, it's great that you really say, hey, like, I'm very interested in this. I'd love to figure this out and get back to you. And I think that's a very great quality to have. So that and kind of leading on all this, because you're throwing out really good tidbits here. I'd love to ask you one more question, and it's kind of a two-prong, interesting pro tip question, I would say. There's things I think, for the people that watch us, everyday people, but then also private practices and private practice owners, So I think there's a way to blend the two in this last question here is, what are some pro tips for everyday people that can, move their health in a better trajectory today? Maybe there's something very small they can take with them with what you say and do right
Sure.
now, right here. And it's something very easy. But then also for the practitioners that are listening, obviously you've been in business for a long time. You have got things down. You do a really great job, and I think it'd be great for other folks, whether they're just starting out or maybe they're feeling stuck with where they are. Is there's things that you do every day in your practice that are really important to you that you think other practices should do, whether it's, how you treat a patient to technology that you might use that you're like, this is a game changer. You should really check this out. So, would love to know
Sure.
any of your pro tips.
Okay, so pro tip for the public. These are really basic and very, very simple. There are basically 3 to 4 main things that you could do. Well, there's probably 10 things you could do actually, but let's just cover a few.
Mhm.
Every person can do these things and they will greatly enhance their overall quality of health. Number one is water.
Mhm.
We are pretty chronically dehydrated in this country. We don't drink enough water. Basically, it's free. You have it on demand at your house. You have it anywhere you want to go. The bottom line is there's a very simple equation to learn, and that is you take 50% of your body weight and you drink that in ounces of water every day. So if
Mhm.
you're a 200-pound person, you drink 100 ounces of water.
Mhm.
If you do anything addition to just normal activity,
Mhm.
such as I went to the gym for an hour and I was sweating. An extra hour of sweaty activity, you add an additional 32 ounces of water into your body and you're hydrated. And those are very, very simple equations, very, very simple
Yes,
tips. Yeah. So that's going to do a lot.
that's
That
awesome.
lowers inflammation. It keeps your hydration levels up. You're going to do much better. Number two is sleep quality. Sleep quality is huge. We don't sleep well because we're up watching devices. Stress levels are horrible. We've got 6 animals in our room. We got 2 cell phones. We got Wi-Fi going on. We live in a society that we work night shifts. The bottom line is whatever your life is, do the best thing you can to optimize your sleep quality and to create a schedule so you can stick to it. The research shows that realistically, the number is between 7 to 8 hours a night.
Yep.
Once you get over 9, you can actually create abnormal things as far as feelings of grogginess, that sort of thing.
Yeah.
When you get under 6 and 5, it really, really impacts your health overall. I lived many years of my life with 4 to 5 hours of sleep a night for decades, and it's come back to roost now. I can't do that anymore. And
Yep.
I really do need 7 hours is like perfect for me. Everybody needs to figure out what that is for them. But
Sure.
7 to 8 hours, according to the clinical research, really is where you should be. Number three, you got to move. If you don't move, you are going to break down. Our bodies are made to move. It's just like anything else. If you don't, let's say you got a 4-wheel drive truck and it sits in the driveway and then you go out and drive it regularly. If you don't engage that 4-wheel drive, the gears of that 4-wheel drive system are going to break down, and then eventually you're going to try to use it and it's not going to work. You have to use it. Movement is lubrication to all the joints in our body, all the cells in our body, to the cardiovascular system in our body. It's our body's designed for it. And so we live in an environment where people don't move. They get in their car. They don't walk anywhere. They're not getting motion and movement in their daily jobs. They're sitting in chairs. They're staring at computers. You have got to move. You got to get up and move. And I have patients that do all these activities, and I'll just tell them set an alarm on your phone, get up and move. I don't care if it's 2 to 5 minutes every 30 minutes, but you got to get up, go to the bathroom, go get a drink, do some
Yep.
stretching at your desk, do something to get up and move and get the breath moving, the blood pumping. You got to do this. Very, very simple. Um, Number four would be food. Again, we eat way too many refined carbohydrates. We don't eat enough fruits and vegetables. People say, "Well, I'm a vegetarian." That really means I'm a carbitarian. I like chips. I like pretzels. I like pastas. I like tortillas and stuff like
Yep.
this. Bottom line is we need to get good quality food in our body.
Yep.
And it's very difficult to be super healthy as a vegetarian. You can do it, but you got to be highly disciplined. And most people that are vegetarians are not highly disciplined on their food intake.
Yep.
I've seen this clinically year after year after year. They have anemias, they've got energy problems, all this issues.
Mhm.
Now, that doesn't mean you go to the opposite side of the table and you eat crappy, processed meats and foods all day long.
Sure.
Bottom line is if you go to the grocery store, shop the perimeter, stay out
Yep.
of all the boxed foods. If it's fresh, if it comes in its own shell, like fruits and vegetables do,
Yep.
that's what you want. Your meats, your poultries, your eggs, those things are actually very healthy for us. Choose organic if you can,
Mhm.
and stay away from all the processed food. 90 years ago, we didn't have over 90% of the food that's on the shelf now didn't even exist because it's man made and it's horrible for us. And if I could get patients in my office doing those four things alone, my clinical results go through the roof because I can't fight a bad lifestyle. There's no way I'm never going to win against that. And as a society, we have not been fighting against a bad lifestyle, and now it's come back to roost, and that's where we're at today.
Yep, I can definitely agree with that. I love all, I mean, I think everything in life, if you pare things down, they're simple. And those are
Yeah,
generally the best things in life. The easy, I wouldn't say maybe the easiest to do because we've been so trained. Like you said, there are all these different type of food products. We have phones, we have all this stuff that affect,
yeah,
quality of sleep. But if you kind of brush away the noise, yes, like the simplest things are the things that work, and
yeah,
that work well for you.
yeah.
So let's try to incorporate some of those things back into our lifestyle than all the shiny objects, right? That we
Absolutely.
at.
Absolutely. Now, for the last part of your question, clinical pearls for anybody who's beginning, new, who's in practice, who's struggling, whatever. I've been there. I've been new. I have struggled. I've struggled more than once. I've struggled a couple times. I've made lots of mistakes in practice, more than I would ever care to talk about. And some of them have been big ones that have cost me a lot of money. They've cost me time with my family. They've made me a worse husband, a worse dad. And so the bottom line is I'm going to have two main points for this. The first point is find a mentor. And I don't care, the mentor should be somebody who's been successful in the ways that you want to be.
Hmm.
Whether that means I want more time away from my practice to spend with my family, or it might mean I need to put more time into my practice so I can grow my practice so I can support my family. Whatever those are,
Yeah.
you need to find a mentor that's congruent with not only your belief systems, but somebody who's going to challenge you in your belief systems. I've
Mhm.
had multiple mentors over the years. And the thing I think that people do wrong when they choose a mentor is one is they choose because somebody else said something about them. You need to vet these mentors. That's number one. Number two is many times you're going to have to pay for a mentor
Mhm.
because when you find somebody out there that's doing what you're doing, usually they don't have time.
Yeah.
Okay, they're busy doing other things. Interestingly enough, if you want something done, give it to the person that's the busiest and they're the one that knocks it out, not the person who has the time to do it
Yep.
because they've figured it out. They're going to teach you time management strategies. They're going to teach you in chiropractic, going to teach you treatment strategies, plans, where to find research, how to communicate better. Because if you can't communicate to your patients, it's worthless. I'm a very highly technical guy. I like detail. Well, most of my patients don't care about detail. They're just like, I want to feel better. So if you're commander data all day long, you're not going to connect with your patient and they're going to go, this doctor doesn't even care about me. I don't care what they know, right? So you got to balance all sides of the equation. Mentors are where it's going to help you. I've had, gosh, I don't know, probably 15 or 20 different mentors over my career, and I've chosen them for different reasons.
Mhm.
One mentor was on business, one mentor was for communications, one mentor is on treatment plans, one mentor is on the science of chiropractic, one was on nutrition, one was on XYZ. And I have looked around many of those mentors again, I paid money for. I paid money to sit in their classrooms.
Yep.
And instead of sitting in the back of the classroom going, well, I paid thousands of dollars for this class and this is a lot of work, I ask questions. I sit up front. I make sure they know who I am. I got a bald head. I stick out. I'm like the bald head in the front. I'm asking questions. I'll go up after lunch.
Yep.
And what happens is they know that you're engaged And when you're engaged, you get more attention.
Yep.
Okay. So then what happens? Hey, we're all going out to lunch. You guys want to join us for lunch? Great. That's where you really learn stuff because that's when it gets not politically correct and real stuff happens. And you go out for dinner or whatever. And this has happened to, gosh, pretty much every mentor I've ever had. I wind up at dinner somewhere or lunch with them, everyone. And half the time they're like, I'm going to buy you lunch, whatever. And I always offer and they never want it because, they're doing great. But the point is, you're putting yourself next to people who are leaders in your profession or your industry. And when you do that, if you will just ask questions and listen, you will grow immensely and you'll grow in different ways. And realistically, all those mentors made me who I am. Just because I'm a hard worker, that didn't make me into who I am. It's the knowledge that I got from these other people and the collectiveness of them. That's where it comes from. So that would be my number one for clinical. Number two for clinical is if you're going to be a doctor who's going to own their own practice, you better understand your numbers. Running a practice is based off of numbers. I don't care if you generate $1 million in your practice. If your overhead's $950,000, you're not going to do well. You're just not. And so you need to know, how many new patients do I need a week? How many patients are going to convert to an active care program? What's the average cost of an active care program? How many patient visits do I need a week on people who are not under active care? What are the numbers week, per month, per year? What's the goal for the end of the year? What's your overhead? How do you pay your employees? What systems do you want to add in the office? What cost of those? How are you going to absorb them? If you don't understand this, you can be the best doctor in the world, but you're going to be an unemployed doctor. Your practice is going to fail and you're not going to help anybody.
Yep.
And so over the years, I've refined those numbers. I've gotten better, better, and better. I know my numbers. I know them by heart. I can dial them in. I know exactly what I need to do. I
Mhm.
run a higher overhead practice, which most people would not want to do.
Yep.
I have 6 full-time staff in this office, including myself, and everybody needs to get their paycheck at the end of the week, right? Nobody
Yep.
wants to come to work for free. So if I can't meet those obligations, I'm not going to do well.
Right.
I have a 3,000 square foot building. I've got 4 treatment rooms, a digital x-ray. I've got 600 square feet of rehab space. I better have patients to fill that. And if I don't, I'm not going to be able to pay off the equipment that I have to do the techniques that I need. When I need to upgrade my x-ray machine next year, which I know is coming,
Yep.
that's $35,000 to upgrade it. I better have that 35K sitting there. And
Yep.
so understanding your numbers and knowing that, building them into your schedule, and then communicate it with your team, communicate it with the other doctors in the office. Everybody has to know the numbers. They have to understand what we're doing. Patient care is always the primary focus of what we do. But
Mhm.
if we don't have the numbers of what we need to maintain the office, I'm going to lose a rehab person. I'm going to lose a front desk person. Now I can't manage the patients. Now the patients are going to be less because we can't manage them. They can't get in a timely manner. Now the revenue goes down. Now I can't pay my rent. Oh my God, what am I going to do? Right? This is for every business. It doesn't matter what your business is. Chiropractors oftentimes don't know their numbers. And in our profession, unfortunately, we have a very high failure rate. Over 50% of male chiropractors fail in the first 5 years, and it's 80% for women.
Wow. I
So,
didn't know that. Wow.
yeah, they don't teach this in chiropractic college.
Mm.
So find a mentor to help you out. I don't, it doesn't have to be a chiropractic mentor. It just could be a regular business mentor. It could be your accountant sitting down with you and going, listen, let's go through these numbers. It
Yep.
could be your mom and dad. Maybe your mom and dad are math teachers. Okay, great. Let's create some basic formulas that I can follow in my office and help me do this. But the bottom line is you got to know your numbers. If you don't know your numbers, you're
Mm.
not going to succeed. Period. You can
Yep.
work on the rest afterwards, but you got to get the basics down. And once you get the basics down, then you can grow.
Yep, it's something that we say very frequently here at Meddkit. Do the basics very well. You will see, your lift, your organic lift, um,
Yep.
and patient and patients and conversions, but the basics need to be done well. And so I love that, this is something that you preach, that you help people with. And the advice that you're giving today, this is incredible. And all the advice and learning about you, your history, to what you're doing now, to all the great tidbits you gave to us. This has been great, Dr. Shawn. I'd love for you to leave off today, just telling folks where they can reach out, where they can,
Sure.
find your practice, and that would be terrific.
Okay, so we're in the Gulf Coast of Florida, Marietta, Florida. That is between Pensacola and Panama City. Um, Reach out to me. I mean, very simple. We have a website, integritychiro.com. You can look us up on the website. Feel free to call the office. The office number is 850 my front desk team, Wendy and Brandy, they field calls from doctors that I've met in seminars that I made connections with. So they're always fielding calls. They'll immediately shoot me an email to my computer, and I usually get back to you within a week or two, or excuse me, a day or two, and then figure out, well, what's going on. Is it can I put you in touch with somebody else? Is there a quick question? Is there an organization you're interested in learning about? um, I'm more than happy to do that. I know a lot of doctors across the country. I mean, easily 300-400 chiropractors that I know actually pretty well because of all the coursework, and because I've been
Sure.
in practice for a long period of time. And oftentimes there's other doctors out there that have the same questions or looking for the same answers, or have figured it out. It's like, hey, well, talk to this person, talk to this person. I'm going to refer to this person. I'm going to refer to this person. I do that a lot, and I love doing that. And I've even had doctors and interns that come and shadow in our office. I have somebody who's shadowing as a medical student, actually shadowing next week. Love doing that stuff. It's an integrative thing, and the more we can connect to other people in the community, the better off we all do collectively.
I wholeheartedly agree. Dr. Shawn, thank you so much for being on
Yeah,
Provider Spotlight today, sharing your knowledge, your story with us, and we hope to have you on again very soon.
sure. Love to do that.
Thanks so much.
You're welcome.